Pop quiz. When assessing the hydration status, you notice skin tinting on the back of the 92-year-old client's hand. What is the most appropriate action to take? A. Notify the physician. B. Only document the finding. C. Examine dependent body areas. D. Check skin turgor on the client's forehead. And the correct answer is D, check skin turgor on the client's forehead. So the first thing you should notice is that we're dealing with an elderly or geriatric patient. Now, because of their age, we understand that they have lost that elasticity. So it's not a good idea to try to check skin turgor or hydration on the back of the hand. Again, they've lost that elasticity. So the best places to check would be something like the forehead, the chest, or even the abdomen. That's number one. The second thing is, let's say you had no idea, that rationale I just gave you, you didn't know that at all, right? You have no idea what the answer is, and you're looking at your choices. Here's a couple other things you need to think about. The first choice, notify the physician. Let me tell you something. Do not choose that as your answer if you have no idea what the answer is. Why? Because usually in nursing, there's at least one thing that you can do for your patient to save their life, to help them before you turn your back to pick up the phone and call the healthcare provider, right? And then when you do call the healthcare provider, what are you going to tell the healthcare provider if you haven't even assessed your patient? What are you going to say, right? So let's get rid of A. Look at B. Only. Stop right there. If you have no idea what the answer is, stay away from all-inclusive answers. Stay away from only, always, never. Stay away from those. Choice, C, examine dependent body areas. Now, if you had no idea what the answer is, you should have just been between C and D and you would just take a guess, right? But you would have been able to easily eliminate choices A and B. So guys, you're not going to know everything, but you got to use, little tips and tricks to still try to get the answer correct.